Bismillahir Rahmanir Rahim wa salatu wassalamu ala Rasulillah. I'd like to welcome one and all to the lockdown guidelines prepared by the Eastern therapists um, during this COVID-19 phase, on guidelines on parenting and guidelines on how to cope during these trying times. So, as you all know, COVID and the lockdown has presented many challenges for everyone. And with the result, family life as we know it has changed. So parents, in addition to their work stress and the fear of illness, are faced with additional challenges of parenting, of educating, supporting and managing their children with little help. Children, on the other hand, are being asked to work in new ways, away from their friends, away from their family, away from the structure of their schools and madrasas. And the uncertainty and the enforced isolation has left many people feeling anxious and overwhelmed. So IMASA, together with the help of all these therapists, has put together this guideline of a few tips on how you as a parent can cope and support your child during this trying time of the lockdown. Our first speaker is then Sister Waheeda Essop. She's an occupational therapist for 22 years. She specializes in medical legal occupational therapy and medical legal reports. She's based in Benoni on the East End, and she also runs the Early Childhood Intervention Center from her practice. It's a center that's got various therapists working together to assist children with developmental delays and learning difficulties. Waheeda is also part of the National Executive Committee of the Islamic Medical Association of South Africa, and she also runs the East End branch. She's passionate about childhood development and stimulating kids to actualize their potential. And she has been actively involved in workshops here on the East End. Waheeda is a proud mom of 3 kids.
Assalamu alaikum. Thank you for that introduction, Zaakir. So from an occupational therapist perspective, I'd like to just give you some gentle guidelines or tips on how you as a parent can cope with kids during these times. So Zaire said, COVID has changed our lives. It's given us a new type of challenge. So parents are faced with this challenge as well as kids. So we've put together these guidelines to assist you. The first thing that I want to talk about is routine. Routine. And I'm sure you've heard this lots of times. Kids themselves they're not always aware of time. And they're used to the bell going off at school or teachers reminding them of what's next. So find a way to keep a schedule and inform kids of what's going to happen. By informing children of what's going to happen, you actually alleviate anxiety amongst children. So when and it can be small things, or sometimes just like things like, today is Friday and we're going to Nani's house, is something that we would take for granted. But as a child, not knowing what's going to happen does create a bit of anxiety. So inform them of what is going to happen and develop these routines with your kids. Try and be flexible, but always be consistent. Set times for different activities. So times for normal activities like bathing and dressing and washing, as well as separate times for schoolwork or play, as well as just screen play. And it also will be an excellent way for them to learn time. The next thing that I'm going to talk about is physical activity. So kids normally are supposed to have 60 minutes of vigorous activities daily. And when I say vigorous, when a child is busy partaking in this, they should be a bit out of breath and they should be able to get only a few words in between. And this is very challenging in lockdown because we have limited space as well as limited resources. So try for 30 minutes, but try and do it outside. What you can also do is adapt their normal activities in a physical manner. So for example, if kids are playing with Lego, let them do some of the Lego or build some of the Lego in a plank position. Or if they have Play-Doh or something else that they're playing with in their hands, they can actually do a squat or while they're playing with it. If you ask them to fetch something from another room, ask them to do a duck walk or a froggy jump, to get there, just so that you encourage them to be active. And if you're doing a workout, there's lots of online workouts for both parents and kids. So have them join you. Creative activities. So these are lovely to do. And it actually is very nice to do on a daily basis. And why? Why would you want to do creative activities? They stimulate a child's imagination. And it's also a way of combating screen time. So remember, when we do an activity, or if you do playing, watching a movie, it leaves very little to the imagination. Everything is there. All the visual inputs are there. So the kids don't actually have to think about something. But when they make something, they have to actively think about it. So have them make something on a daily basis. It can be a cooking task, it can be a baking task, it can be a craft activity. But try and give them minimal instructions initially. So if you give them a page and say, let's do something with this, don't say, do a drawing or paint on this. Say, what can we do? And let them come up with ideas. So you could do origami with them, Play-Doh, painting, drawing. And again, there's lots of ideas online. Gardening. It's the perfect time for this new therapeutic hobby. And if you don't have a garden, you can always do an indoor garden. Besides the developmental benefits of improving fine motor skills, sensory development, coordination, gardening also allows kids to be outside. But then it also gives them a sense of responsibility in terms of taking care of something. And thus, in turn, allows for something called delayed gratification. So they have to wait for results. And again, when you have things like screen time, you have immediate gratification for kids. So that activity is fun, but it's fun all the time. So allowing them to engage in something like gardening, where they have to wait at least a week to actually see results, is a very good, you're actually teaching them a skill in terms of delayed gratification. Daily chores. So try and draw them into these. These can be discussed with kids initially and outlined. And why? Why do we need to give them this? Kids need to know that they are part of the family. And as part of this family, this is my duty. So it gives them a greater sense of involvement. And it also helps with developing that sense of responsibility. So chores generally, they offer skill. So if you think of anything that the kids will do, whether it be setting a table, making their bed, or sweeping, they are attaining a skill. It also stimulates what we call motor planning. So if you think of a new task like folding a blanket, they've got to fold a blanket and they've done it and they're doing it for the first time. They've got to fold it in half, and then again they've got to figure out how much is enough in terms of folding, and they are stimulating their motor planning. And this comes with any new task that they do at home. So once kids do engage in this kind of activity, it also helps again with their delayed gratification, because doing a chore is not always a fun task, and life doesn't always have fun activities. So when they have screen time or playtime, those are usually fun. But then they've got to go back to school and they've got to learn again, and they've got to do tasks that are not so pleasant. So it allows them to develop that sort of almost like an endurance or a perseverance to do a task or engage in a task that's not always fun. When kids do these tasks, they feel I can do something. So that in turn instills confidence in them. And with this confidence, they actually develop or are able to know, have the confidence to partake in anything, in any other activities. And lastly, all time in between is playtime. So encourage them to play with whatever they wish. When kids play, there's movement involved, there's sensory involvement. This allows for what we call connections in the brain. When there's connections in the brain, there are new neural pathways forming. When these new neural pathways forming, there's something called brain integration happening. Brain integration equals brain growth. And when brain growth happens, that's when development happens. It obviously excludes the screen. So that wraps up the segment. I'm going to hand you over back to Zaakir. Jazakallah khair.
Jazakallah Waheeda for that excellent presentation and a brief introduction to our guidelines. I'm going to hand over to Waheeda now again to go through Sister Nabeela Kathrada's presentation. Sister Nabeela Kathrada is a speech therapist based from Johannesburg, who's qualified at FITS. She currently works in private practice, servicing both the pediatric and adult populations. She's currently based in Benoni at the Benoni Speech Therapy Practice Center, which is at 4B Russell Street. And she also is part of the, as we mentioned with Waheeda, the Early Childhood Intervention Center. She offers both speech and hearing screenings to schools in the area. Services are also at select schools in Kempton Park, and she also does home visits. She is vital trained and is currently conducting research in AAC implementation within the South African context. So we're going to hand over to Sister Waheeda to present Sister Nabeela's.
Jazakallah khair, Zair, for that. Yes, unfortunately, Nabeela was unable to make it this evening, so I'm going to read out her presentation for her. And her topic is a very popular one, and I think it's one of the bigger challenges that we have as parents. So the first segment is which is her segment, which is an introduction to screen time. So I'm going to just discuss a bit of screen to start off with. And if we consider there's the surge of the amount of screen time that is required by both parents and kids due to the many educational activities that are taking place. So I hope you guys are not getting dizzy with my picture there. But if it is, then that is one of the effects of too much screen time. So your leisure activities and your social interaction have also largely expanded onto online platforms. So we ask, why not? Why shouldn't kids have increased screen time? And the first thing that we regard or we consider that the parents have to consider is that screen time is actually stolen time. So these activities allow for they take kids away from activities that allow for stimulation and involvement of their senses. It allows normal activities, meaningful activities, allow for more movement. They engage the brain to it, and they allow development. So screen time takes away this time. The other reason is that when you have a child watching or playing on a screen, they have continuous fun. So they're getting continuous feedback, and they're used to this immediate satisfaction. So when they move from that to having to partake in a normal activity or school activity, they don't want to engage. So they give up or they get bored easily. So it doesn't develop what they call their delayed gratification. I think I mentioned that earlier as well. And this is an important life skill, the delayed gratification, because if you think of having a job or in a relationship, things are not always pleasant. So if things get a bit harder, you can't obviously give up or walk away, and you need to develop the skill. It's a necessary evil. So we need to adapt the way we interact with technology time. So generally, we need to set to screen time. This needs to be discussed with children, and you need to get an agreement from them. When I say get an agreement from them, they need to be part of the decision making to say that, listen, this is my screen time, this is how much I'm allowed, and I have agreed to it. So also discuss consequences of what happens if they do not comply. So to say to them, okay, so if you do not adhere to this time, what should we do? And let them be part of that decision to say, okay, then I won't get screen time for the whole of next day or whatever it is. And the most important thing is to follow through with that. Always keep control of your devices. So keep them with you. Try and have a set place for them. The children can know, you don't necessarily have to hide them away, but the children can know where they are. But when it is time for children to use the device, they need to come and ask you permission to say, Mom, I'm having my 20 minutes of screen time or whatever it is. Can I take the tablet? So that gives you control over the devices. If you leave them lying around, it's obviously going to be tempting for them. They're going to pick it up and they're going to play and they're not going to stop. On average, a child with a tablet or a phone, screen time can be capped at about 60 minutes per day. And this can be divided into 2 to 3 sessions. And you can decide how you want to play that. So if you want the last session to be a total complete reward session for their behavior for the day, you can do that. But you need to keep the time. So either on the device itself, or you can keep the time on your phone. What worked well with my kids is a kitchen timer. So a kitchen timer has a tick tick noise, and then it makes a loud a noise at the end when time's up. So both the child and the parent can hear that. And remember to separate your screen time with your educational screen time. So make a distinction that, okay, now you guys are doing schoolwork and now you are actually playing. So try and use media to fuel your child's natural curiosity. So instead of leaving them alone, interactive screen time has shown to be more stimulating and enhances social and cognitive language abilities. An example could be to make funny TikTok videos or watch a YouTube channel that enhances creativity, such as baking or craft making. For younger kids, there's also many interactive story time activities that can be used to enhance reading and interaction. Try to balance your online and offline activities. So this is the best time to introduce your kids to all your most loved board games of the 90s. So instead of having them scheduling 30-minute breaks, it may be better to chunk in a large amount of time without the screen, especially if the kids are older and they are using screens for educational learning. So their leisure time should large screens. So play 30 seconds, Monopoly, Twister, Scrabble. It will keep the kids entertained and screen-free. Instead of allowing them to leisure time to be gaming or watching videos or movies or series binges, rather let them kids interact with their friends and family through video chats. So this will allow them to receive social fulfillment and also allows for adaptation of technology in a more meaningful and engaging way rather than inhibitory. So video call or FaceTime Nani or Nana or have Zoom meetings with their friends. Many kids love interactive gaming. While it can interaction, it also causes concerning behaviors and a decrease in real life meaningful experiences. So it's important to give alternatives and negotiate with your children. This appeals to them as they believe that they are active participants in their decision making. So advocate for family time and engagement with members rather than online activities during their free time. So for the little ones, that when you need a bit of screen time, or if you need to attend an urgent meeting and you need to have them engaged, try the best materials are high quality educational programs that allow for stimulation. So YouTube is full of interactive and educational videos where screen time expands to language and learning. So be sure to know exactly. So view it yourself first. And when they are busy with the screen, try to watch them or have them close by. If they're not close by, try and check on them intermittently, just to see what they're watching, because it's very easy for kids to change the app and to go into something else. So and also know that you are checking on them intermittently. Maybe I shouldn't change the app because I know mommy's going to come and check on me. Okay, then for the older ones. Okay, so when I say older ones, I'm usually referring to your high school kids. I actually, we think that kids in primary school shouldn't really be having a cell phone. They don't really have a need for a cell phone at a primary school level. It's very difficult though. So know your kids' passwords. So you should actually be able to know access their phones at any given time. In other words, know what they're watching, who they texting. You can also follow them on Facebook and Instagram to keep an eye on who they are following and who's their followers. So this is ideally done at the onset. So when you hand them over a phone, to say to them that, listen, I'm giving you the phones, but these are my rules. And the reason that this does sound like an impingement of their privacy, but the reason, if you consider this, children spend a large amount of time on their screens, and it is our responsibility as parents to supervise them. And if they have this large chunk of their life on the screen, we should be able to access that and supervise what they are doing. So it's also our way of not only supervising what they do, but also of keeping them safe. And if kids are even if we don't do it on a very regular basis, but kids know that they're going to, mom's gonna take my phone or check my phone or see what I'm doing, in the back of their mind they are less tempted then to open up an app that's unsuitable or to overstep their boundaries. Yes, so that's the older kids, and that's the screen time introduction. So thank you very much. I'm going to hand you over back to Zaakir.
Our next speaker is Sister Aamina Amojee, who's a physiotherapist who graduated in 2012 from WITS, and she did her community service at Krasani Bergwanov Hospital. She then continued in the private sector in Germiston until early 2018, where she went into private practice. She now currently works at a private rehab center in Moorhill in Benoni. Aamina.
Jazakallah Zaakir for that introduction. Assalamu alaikum wa rahmatullahi wa barakatuh. I will be presenting part 3, which is posture in the screen. So what is posture? Posture can be defined as the attitude assumed by the body either with support during the course of muscular activity or as a result of a coordinated action performed by a group of muscles working to maintain stability. There are 2 types of posture that we can discuss. The first one being dynamic posture. It is the way in which you hold yourself when you are moving. For example, when you are walking, running, or even bending over to pick something up. This is the basis of movement. Static posture is the second one. It is the way in which you hold yourself when you are not moving. For example, when you are sleeping or sitting or standing. This requires the coordination and interaction of various muscle groups to counteract gravity. Our bodies have been designed to be in an erect or upright position. Take a scenario where you are sitting, be it in front of the PC, the laptop, the phone, television, or whatever it may be, for a period of 2 hours. In this time, our head, spine, and shoulders all go into a forward position, known as the slouched or slumped position. Our muscles and ligaments then begin playing a tug of war to keep us upright. Good posture. Good posture is more than just about standing so that you can look good. It is an integral part of our long-term health. A good posture assists us in preventing pain, injuries, and other health problems. The key to a good posture is not just shoulders back, tummy in. The key to a good posture is the position of the spine. The spine has three natural curves, the first being at your neck, the second being at your mid or upper back, and the third being at your lower back. A correct posture should maintain these curves but not increase them. Your head should be just above your shoulders, and the top of your shoulder should be over the hips. Poor posture. Poor posture or slumping over can lead to a variety of problems. The first that we can talk about is that it increases pressure on the spine, making you more prone to injury and degeneration. It causes neck, shoulder, and back pain due to stiffness or incorrect muscle activation. It decreases flexibility. It affects how well our joints move. It affects balance and increases the risk of falling. It makes it more difficult to digest food. And also, it makes it difficult for us to breathe at times. So, how do we correct this? There are a variety of strategies that can be implemented to correct this. Due to time constraints, we will only discuss the following, which is device setup, regular or intermittent breaks, physical activity, as well as education. Device setup. When we're sitting, the device needs to be in front of us. Viewing distance needs to be approximately between 40 to 76 centimeters away from the eye. The topmost line of work at approximately eye level. One of the tips that we often give out is popping a ream of paper under the screen or the monitor. And then you can either just get in paper or remove paper to adjust the height. Make sure you sit back in a seat and use a backrest for support, giving your back muscles sufficient rest. Forearms should rest on the arms of the chair while typing or placed on the table to give support to the shoulder muscles. The keyboard should be in close proximity to avoid reaching forward or reaching to the side. Feet should be placed on the ground and not just hanging. If feet are left hanging, it alters the position of the pelvis, and this can cause lower back pain. Again, one of the tips that we provide is just popping a ream of paper or a box or so on to rest your feet on if your chair is not height adjustable. Intermittent breaks. It is recommended that we break from technology every half an hour. One of the tips that we provide again is setting a reminder on our devices, which help in giving us time or reminding us to take that break. During the break, basic movements like walking around the table, a couple of stretches, marching on the spot are recommended. One of the other things that we also suggest is getting a little bit of fresh air, going outside for a couple of minutes, not just for a smoke break for the parents. Physical activity. Exercise offers incredible benefits that can improve nearly every aspect of your health. It is recommended that we engage in physical activity for half an hour, 5 times a week. This may include any type of physical activity such as skipping, Pilates, running around the block, running up and down the driveway. Physical activity also reduces pain and discomfort. Our bodies are designed to move, and any form of restricted movement or being in one position for too long can most likely lead to pain and discomfort. Exercise has been shown to improve mood and decrease feelings of depression, anxiety, and stress. Exercise is crucial in supporting a fast metabolism and burning more calories per day. This helps either with weight loss or maintenance of weight. Regular physical activity can help you sleep better and feel more energized during the day. Our bodies use learned motor patterns to perform everyday activities. When we sit, stand, or move, our body follows previously learned motor patterns, like habits in a way. So if our body has learned to slouch, then this is what it will do. This is why it is vital to educate our children from a young age on the importance of posture. It's sitting to do work, play games, or even something as simple as sitting on the eating table to have supper with the family. This will then become part of routine to them, and they will be able to carry that on into their teenage and adult years, inshallah. There are various gadgets on the market that may help us and our kids to maintain a good posture. Many of them are adjustable to some degree. For them to be effective, they do not need to cost an arm or a leg. They just need to be adjustable to a certain degree. This slide shows a couple of basic yet effective stretches that can be done by the parents as well as the kids. It is recommended that stretches be held for approximately 15 to 20 seconds to achieve maximal benefit. Jazakallahu khairan. This is the end of my section regarding posture, and back to you, Zahir.
Jazakallah, Aamina, for that interesting talk. I'd now like to hand you over to Brother Zaakir Ebrahim, who's here to present a presentation compiled by him and his colleague Farzanah Cassim, who's qualified at the University of Johannesburg, and she runs practices in Benoni and Springs with Osman's Optical. They're going to talk about the optical strain and things we can do to mitigate the optical strain because of this increased screen time that we're having.
Okay, no problem. So, Assalamu alaikum wa rahmatullahi wa barakatuh. So basically with digital eye strain, what we need to know is that when we're spending long hours in front of the computer, this causes things like headaches, tired eyes, and burning eyes. Now, many of the students think that it's the homework, but it's actually the strain of the eyes. So when we focus for too long, we actually can feel it go into our head as well. So what we need to be aware of that this headaches, this tired eyes, this burning eyes, or heavy eyelids, or blurred vision even, these are all symptoms that we can experience, with all the digital eye strain. So you see, there's many ways how we can cope with it. That one of the things is to know your visual status. That to see is your script up to date. Normally, the optometrists recommend an eye test every 2 years, because in 2 years, your eyes can change. So what happens if your script is not up to date and you're struggling more now to focus on the image? That's where the headaches and that can come into. And most of the time, the digital strain is possibly due to the incorrect script. So sometimes, even if there's a small script, it still affects the results, And there is things that we can add on our glasses, like they call it the anti-glare, ARC, anti-reflex coat. It all means the same thing. So what this does, it reduces the digital strain and the discomfort on our eyes. And one thing that most of us experience when we're using computers or looking at tabs, we actually forget to blink sometimes. So we're working so much and then we forget to blink. And what happens in this case here, it starts to dry out our eyes. And now when your eyes get dried, it starts to feel burny and irritating. So one thing we can do, we can remind ourselves to blink more often. That spreads the tears. And we can even use eye drops as a supplement, but the best thing to do would be to blink your eyes. And we should even keep reminding ourselves to blink our eyes. Okay, and it's very important that we take breaks. Sometimes we need to set the alarm, to remind us, because when you're busy with work, you work so much that you even forget. The time goes by so fast. So we have a 20-20-20 rule. What it means that when you do 20 minutes screen time, you should take a break to look and focus on something that's 20 feet away. That's anything in a distance for 20 seconds. And you should even try to take a walk for every 45 minutes to exercise, to walk around, to wash the face, to rejuvenate the eyes as well. So all of this here will help, you don't get too fixed in that time where you don't take breaks. Sometimes, especially with guys that are gaming and that, they can play up to 1 hour, 2 hours, 3 hours and not take breaks. And by the end of all of us here, they got headaches, burning eyes, everything. So also it's important, like they've mentioned previously, our working distance. So generally for reading material, we try to keep it at 40 centimeters. When you have a computer screen, it's a bit further. So that's your screens and devices can be about 40 to 45 centimeters. So the Harman distance is basically the distance from our wrist to our elbow. That's a short way to teach smaller children even the distance that they should be reading at. And like they've mentioned previously, the screen height and posture. So firstly, the screen height, it should be, they say about 15 degrees below our line of sight, because we don't want the glare from the screen coming directly into our eyes. That this can cause some discomfort. So it's better to have it below our eyes. And what we can do even is to use holders and stands for tablets and to sit upright and correctly with full contact on the chair. I'm not a chiropractor, but your chiropractor will tell you that the worst thing to do is to slouch over, you know, especially when you're doing long hours of work. So we should try to sit upright and not slouch over or lie down or anything like that. So this is good for a direct visual focus, and it avoids neck and shoulder pain or strain. And what we can do, so many of the problems that we get from the screens is the glare. Some computer shops do sell a glare filter, which we can use to put over our screen. Sometimes we can adjust the tilt of the screen to avoid the reflections. And we can even adjust the brightness of the screen for something that's comfortable, to make it a bit dimmer during the night, especially when the room is dark. So to decrease the brightness and to increase the size of letters. Sometimes that makes it easier, so you're not straining too much looking at those tiny letters. And to also adjust the contrast of the screen so you can tell the difference between the letters and the background. That's the difference between the black and white. And in the end, we need to take a real break. Sometimes we think we're taking a break, but we actually, while we're working, we take a break and then we're busy on our phones, we're busy on Instagram, we're busy on Facebook. So like that, we're actually overexerting our eyes. So it's not actually a break. And the best thing that we can do sometimes is just to lay down and close your eyes and just for 5 minutes, just to relax. Try not to fall off to sleep because, you know, we have to get our work done, but just to relax your eyes, to avoid overstimulating the eyes sometimes in the brain. This can even be advantages to us. So Jazakallah for that. We hand it back to Zahir, inshallah.
Jazakallah Zaakir for the interesting presentation. We now want to hand you over to our sister Faaiza Lahe, who's a dietitian, to give us healthy eating tips during this lockdown. Just a brief CV of Sister Faaiza Lahe. She's a registered dietitian, wife and mother to 3 beautiful girls. Her lab is a kitchen where she shops, stocks, and prepares some deliciously nutritious, healthy meals and snacks. She's passionate about nutrition and healthy eating. Faaiza believes serving up healthy meals and snacks is the first step to ensuring a healthy family. She works to provide you with the tools, credible and reliable guidance, and lots of expert advice to make your healthy family dream a reality. And when she talks healthy foods, she tries to help you envision the color and texture. Variety is always a must, she says. She sees spinach, cinnamon, dark chocolate, crunchy baby carrots, flavorful drinks, bright-colored sweet peppers, juicy strawberries, oranges and limes, and nutrient-dense lentils. A graduate of the University of the Free State and completing her community service also at Kutsani Baragwanath Hospital, Faaiza has since come a long way and has a wealth of nutritional expertise to offer your family. She currently works as a clinical dietitian at the Garden City Clinic. I want to hand you over to Sister Faaiza Lahe now.
Okay, Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much for that introduction, Zaakir. So one of the most important questions that I've been getting since lockdown is, how can I improve my immune system? How can I boost my immune system? How can I support my immune system? So we can't actually boost our immune systems, but we can support our immune systems by eating healthily, looking after our diet. So for example, trying to be happy most of the time, getting outside, getting some exercise, some sunshine, maintaining a blood glucose level, so which means eating the correct foods often, providing enough energy for our bodies to grow, and also healthy eating supports healthy learning as well. So lockdown has been tough on a lot of people, especially the little ones who have been at home, missing the company of their friends and their teachers at school. So whether you have a toddler or a teen, they're all hungry much more than usual. They're looking for snacks. They're in the fridge. They're in the snack cupboard. They're in the bread tin, and they're always looking for something to eat. And hungry is normal in normal growing healthy children. And what you would want to look for is when kids are overly hungry than what they would usually be if they were at school. So some strategies that we can use to prevent kids being overly hungry is having regular meal times. So sitting down to a decent breakfast most mornings, a decent supper, and then lunch with whoever is at home. Serving a variety of healthy foods and snacks, being a role model yourself by eating healthily, avoiding battles over food. So we know as parents that a lot of battles, we're not going to win every battle with our kids. And sometimes the little ones we need to, overlook. Involve children in the process of what they would like to eat, what they enjoy to eat, and what is healthy so that a balance can be achieved. Stocking up on healthy food items and keeping healthy foods visible on the counter and always available is one way in which children can avoid eating junk food. So work fruits and vegetables into their daily routine. For example, like offering a grated apple in their oats in the morning for breakfast, or some chopped fruit on the side of a breakfast. Make it easy for kids to choose healthy snacks. By keeping fruits and vegetables on hand and ready to eat, other good snacks include things like low-fat yogurt, peanut butter, whole grain crackers and cereals, and low-fat cheese. Serve lean meats and other good sources of protein. So you would want to cut out as many junk or processed meals and processed meats as much as possible. Offer fresh meats which you've marinated at home. Add lots of herbs and spices to these, and include a variety of fish, eggs, beans, and nuts. Lots of whole grain breads and cereals, so children get enough fiber to keep their tummies also regular. Limiting their fat intake by avoiding fried foods and choosing healthier cooking methods like grilling or roasting or steaming, and choosing low-fat or non-fat dairy products. Limit fast foods and low-nutrient snacks as much as possible. So try and have just 1 or 2 meals in the weekend where they can choose a takeout meal or something that would be a treat from what they ate during the week. And limit sugary drinks like sodas and fruit-flavored drinks as much as possible, and serve water and low-fat milk more often. Creating an independence in the kitchen is really great. And I know a lot of moms are tired of being in the kitchen all the time. Everybody's always hungry. So the best thing to do is to get the children involved. They can set a menu. They need to know what ingredients they're going to need, and then cleaning up also when they are done. So they can learn to peel and chop potatoes and carrots, chop spinach, dice peppers, tasting these while they're busy. And it's also a great learning curve to teach them how to pack their own lunch boxes once school starts again. And they can smell and taste the different varieties of warm winter spices and combinations to make delicious drinks and desserts. They can, for example, try things like cinnamon and honey French toast, which is high in protein because it's dipped in egg also at the same time. Something like a cinnamon and nutmeg hot chocolate, or avocado toast, which is really simple to make. So as Waheeda said, try to keep to a routine. And as she said, a routine is a child's best friend. So helping them or, assisting them to pack a small lunch bag or small lunch tray. And a small lunch tray will include a fruit portion, a vegetable portion, a dairy portion, a whole grain, and a meat or meat alternative portion. So eating often, allowing them to eat on their break and getting those lunches outside, and then making sure that they have, again, enough fruits and vegetables to keep their tummies regular. Because if they're going to be at the computer or at the desk most of the time, we don't want to have a child that's going to be suffering from constipation. Fluids are really important, even though the temperatures have dropped and it's not as hot as our summer. Fluids are really important to keep, body fluid maintenance and to make sure that they're getting in enough fluid. So we want to avoid a lot of sweetened drinks and a lot of drinks sweetened with non-nutritive sweeteners. So water or diluted fruit juice would be the best thing to go for. Okay, homemade juices can also be calorie dense, so keep these to a minimum. And milk is a really great fluid source, especially after exercise or after 30 minutes or half an hour playing outside. Milk is really a great source to build protein, to keep bones strong, and to keep hunger at bay. Other fluid ideas would be things like fruit-infused water, vegetable-infused water with mint leaves, ginger, or cucumbers, diluted fruit juices, sparkling water with mint and lemon, or diluted iced teas and sodas for the weekends. Herbal teas are really great towards the end of the week, like towards the end of the day, like for example, chamomile tea to aid in sleep. And be careful not to include too many fluids too close to meals, as this would contribute to poor intake. Now, children need a variety of nutrients to stay healthy and also to maintain their immune systems. So we usually talk about a healthy eating plate, which consists of half a plate vegetables, a quarter plate starch, and a quarter plate of meat. So if we combine all these nutrients or all these food groups, as you can see on the screen, if you include, like say, for example, fish for supper, we've had a little bit of vitamin A and some high quality protein. If we'd had some lemons or lemon juice drizzled on the fish, we'd get some vitamin C, including some spinach or maybe some salad on the side, we'd get some iron. And then from the starches, we'd get some fiber and B vitamins. These combinations are the best way for absorption to take place in the gut. So usually taking a multivitamin is not ideal, but from food sources, this is the way it would be best absorbed. Breakfast is the most important meal of the day. And since schedules are a little bit slower, especially since kids are not all back to school, a nice breakfast, a decent breakfast in the morning where the whole family is together. So some, yogurt and chopped fruit, or a whole grain or cooked porridge like an oats, or maybe some, an egg on a toast with a little bit of spinach on the side are some really great breakfast ideas. So again, eating from their snack tray, so they could have some nuts together with some fruit, or hummus with some vegetable sticks. So what you would want to do is swap all the unhealthy snacks for healthy snacks. So for example, chips for vegetable sticks or for nuts, swap coffee or tea for unsweetened chamomile or rooibos tea, increase the size of whole grain, decrease the size of whole grain salty snacks with a side of fruit, swap sugary sweets for nuts, and swap biscuits for oat-based crunchies or a yogurt. Children do need to be active, and the more active they need to be, the more calories they will need to include in their diet. So this is just a basic guideline of calories for different types of activity levels for children. But if you would want, and if you are worried about your children, you can consult your dietitian in your area to, help you with a meal plan. So as I talked about earlier, the healthy plate for children would look a little smaller than adults. We would want half a plate vegetables, vegetables and fruit, which is where we'd get most of our nutrients, a side of carbohydrates, whole grain, preferably unrefined, and then a side of protein for muscle building and muscle maintenance. Thank you so much. Back to you, Zaakir.
Jazakallah khair, Faaiza, for that. Jazakallah khair, Faaiza, for that nice talk on healthy eating and healthy snacking. I think there's a lot of information there which you can put in practice. Our last speaker in the formal part of this program is then Dr. Sadiyya Lahe, who's our last speaker in this, is Dr. Sadiyya Haffejee, who's a psychologist. She's currently the manager of the Kids Haven Clinic Kids Haven Therapy Clinic in Benoni. She's also a senior researcher for the Center for Social Development in Africa at the University of Johannesburg. Sadiyya has a special interest in youth mental health and resilience, specifically when it comes to youth with adverse life experiences, sexual and gender-based violence, and social justice issues. I'm going to hand you over to Sadiyya. Sadiyya.
Assalamu alaikum. Sorry. Okay, so Jazakallah once again for having me on this forum and for enabling this space where we can talk through some of the challenges we are all experiencing at the moment. My colleagues have shared some really, really excellent ideas on how to cope and adapt. And I'm just going to look very briefly at parenting and emotional well-being during this period for both ourselves and our children. Okay. So before we continue on to the tips on how to cope, I just wanted to give a brief overview on the mental health impact of COVID. As Zaakir has said, and the others have also said, that the pandemic has really resulted in unparalleled changes to our daily lives. Although we are gradually emerging from strict social isolation, our lives have not returned to normal and may not return to normal for many, many months to come. For most of us, this is the first time ever that we're experiencing something of this scale and magnitude, and we have no script or previous knowledge on how to deal with it. It's this newness and the sense of not being in control which creates feelings of anxiety and stress. Internationally and locally, there's an increasing concern about the mental health impacts. And understandably, many parents are concerned about how all of this will impact on their children. I've just added a little slide here of the findings from the South African Depression and Anxiety Group, where they showed that there's been a 55% increase in anxiety and panic during the lockdown period. And obviously, the way this COVID and the lockdown has impacted on people is very much dependent on where they are, their social and living circumstances and their financial circumstances. So in terms of the impact on children, this crisis is a lot for children to handle and to comprehend. Children have experienced numerous losses during this period. Their sense of safety of this world and their understanding of this world has really been shifted during this period. Their normal routines have been lost, and with this, their access to friends, families, schools. And for many children in South Africa, it has also meant that their access to basic resources has also been limited. So for some children, not being at school has meant that they are not able to have one meal a day, or they're not able to access any learning opportunities if they're not privileged enough to have access to Wi-Fi and internet. And for other children, being at home and being away from their normal routines have also meant that they are spending a lot more time at home with families, and in families where there's familial stress or domestic violence, children are kind of more exposed to this and taking on the secondary stress as a result as well. So obviously all of this has serious repercussions and long-term consequences for children. How children may react is also very much dependent on their age. So we may find, for example, that young children are actually quite happy being at home. They're happy to have their parents at home and to not go to school. Whereas teenagers probably are feeling quite bored. For them, being with their peers is more important right now in this developmental stage than being with family. So they may be becoming frustrated and bored at home. So what are our children feeling? On this slide, I've just got one or two pictures from a recent study that we did with kids at Kids Haven, and you'll see that for some children, this has brought up feelings of fear and sadness, fear of loved ones being hospitalized as a result of this and dying. Other children have been happy, like I said, and then there's feelings of frustration and boredom. Children often don't verbalize their feelings. So many times children won't tell us how they're feeling or what they're feeling. It is up to us as parents, and because we know our children, to look out for the little telltale signs that show us that they are not coping very well. Okay, so, and it's also important to check in with children. So to ask them questions about how much do they understand about what's been happening, what are some of their fears, and to ask what they need at this time. So when children are stressed, it's often expressed in physiological changes. So you may notice changes in appetite, sleep disturbances. They may be either sleeping too much or too little, eating too much or too little. You'll see changes in mood. You'll see children needing more reassurance. So they'll be asking you more questions, and they may be a little bit more clingy, following you around the house. Some children, maybe older children, may withdraw a little bit. Often we get somatic complaints, so children will complain about having a stomach ache or headache. You'll find there'll be changes in behavior. So sometimes you'll see children that have already passed one developmental period becoming regressing. So starting to suck their thumb again, or not being able to maintain, for example, if they have already been potty trained, all of a sudden they can't do that anymore. So there'll be little changes that you'll notice in your children. And these are all signs to look out for. So you need to know what's their baseline, what are they usually like. And if you are seeing things that are different to this, it's perhaps time to check in with them and connect and see what's happening with them. So, we've spoken a lot about children, and this whole discussion was really how to support children and parenting. But I wanted us to just take a moment to pause and consider where we are at as parents and as adults. How are you feeling at this point? For many of us, this has been a period of really mixed emotions. There's been gratitude for some of us for our life, where we are in life. For others, there's been exhaustion, fear, and just generally feeling of being tired, trying to balance and juggle so many different things. And an essential part of children being well and coping and adjusting is to ensure that we are well and that we are coping and adjusting. So it's important for us to kind of reflect on where we are at and what our needs are at this point before we are able to help our children. So here I've just got a slide that focuses a little bit on you as a parent. How do you fill your cup? How do you take care of yourself and monitor your behavior? So we really need to be aware of our stresses and consider whether we are passing some of these on to our children. How can we take care of ourselves? We can do this by finding and accessing our sources of support. So it's really important to maintain connections with family, friends, and social services. Social distancing does not need to be total social isolation. And it's important for us to strengthen our core skills. It's important to remember that when we are stressed, our bodies respond by activating stress response system. And this means that we are in a heightened state. In the short term, this is okay, but in the long term, we start seeing a number of problems health-wise and mentally as well. So during this period, it's also important for us to practice self-compassion and self-care. We need to validate our own feelings as adults and engage in activities that help us to self-regulate. Self-regulation is particularly important and refers to your ability to regulate not only your emotions, but also your behavior, your attention, and your thoughts. It's important for children not only to see their parents regulating their emotion, but also to learn from interacting with adults how to regulate their own emotions. And at the moment, there's so many great resources available if you've had a chance to look at some of the online things on social media, on Facebook, on the internet. Essentially, it's about finding what works to calm your mind and how to settle your feelings of anxiety. So some ideas are around zikr, that often is really good to kind of calm you down, practicing mindfulness, or yoga, exercise. Everyone has spoken about the importance of exercise and the benefits of that. We could read, we could talk to people, we could reach out to other people. It's important for us to address our feelings of helplessness by focusing importantly on what we can control. So much of this is about what we can't, so much of this is something we are not able to control. But what is in your space, in your home, what is it that you can control? And getting a sense of that will help you kind of feel less helpless and less hopeless. And it's also important to remember that you are really driving this process at home. As a parent, you are the driver and your children are the passengers. So you need to manage your own anxiety and calm yourself down without having them see that you are all over the place. Because if they see you not coping and not managing, they'll feel unsafe and also will react negatively. Okay, so how do we support our children? Once we are in a good state, we are more able to attend to our children. In this slide, I'm really sharing a very basic template on what's needed to kind of calm your child down and to contain your child. This is based on 3 principles, which is regulate. So help your children become calm and feel safe. This you can do by drawing, breathing, reading, a lot of just the activities that some of the other speakers have spoken about previously. It's really about just grounding the child a little bit. When children are feeling dysregulated, when they're in a heightened state, they're not able to listen to you, they're not able to learn, and there's no point in trying to teach them any skills. So the first thing to do is really to calm them down. Secondly, it's really important to connect and relate with your child. You need to be sensitive and compassionate. You need to validate their feelings. So tell them, I can see that you are upset right now. I hear you. And I know this is a difficult situation. So we really need to get down to their level and attach to them in a way that's meaningful. And lastly, it's important once they are regulated and once we have connected with them, then we are able to reason with them. So here we need to support the child to reflect, learn, and process. So in this stage, we can then start saying, okay, well, what other behaviors are more appropriate for this point? And it's also important to set boundaries because as much as you connecting and understanding your child, you're also setting limits to what is acceptable and what is not acceptable in your home. Very quickly, some practical tips that I see a typo. Everyone has spoken about routine and it can't be overemphasized really. There's children need routine and structures. Having a boundaries in place is really important for children to feel safe. It kind of contains them and makes them feel like somebody has got them. So when children are running out of control and nobody's pulling them back and stopping them, they feel like nobody's taking care of them. So you need to create that routine in your home and a schedule that works for you and your family. It's important to recognize the positive. So praise and acknowledge your child. Use positive words to encourage them. And also manage your expectations. Are you feeling stressed and then taking it out on your children? Are you asking too much of your children? Are they really able to do all that you're expecting them to do? And then create a sense of safety. Reassure children during this time. Spend extra time with them as a family. And I know in saying that also that's difficult because sometimes we feel like we're spending too much time with our family at this point. But maybe spend time to do fun things. A lot of the time as parents and as moms, we are telling our children what to do. Pick this up, do this, do your homework, finish this. And it's constantly about orders and rules. So sometimes we just need to pause and have some fun with them. How do we manage bad behavior? So sometimes the best thing to do is just to not focus on the bad behavior, to redirect your attention and their attention from the bad behavior. So you can do this by ignoring it, or you can distract them, give them alternatives. Or tell children that every action and every behavior has a consequence and spell it out for them so that they know when they are doing it, this is what the consequence will be. And it's important to be able to follow up with this and to ensure, obviously, that you are not doing anything that's excessive and that's harmful or hurtful to your child. Again, it's important to know yourself and to be aware of what's happening inside of you. If you begin to start feeling overwhelmed and angry, then take a break. walk away from the situation till you're feeling able to address it and deal with it. And it's really important for us to remember that children are children. They will misbehave, and that's very normal. When they are bored and haven't slept, or when they have watched too much TV or are feeling anxious, they are going to act out. And again, that's when you need to regulate, calm them down, and then change and redirect their behavior. And lastly, just to come back to you as a parent and caregiver, you need to remember to be kind to yourself and ask for help. Asking for help is not a sign of weakness, but it's a sign that you're self-aware and that it demonstrates strength. So it's important, if you know that you are not coping, or if you feel overwhelmed more of the time, that you can access help. And you can either do this through accessing your own social networks or speaking to somebody professionally. And at the moment, there's loads of online resources where you can access help. Okay, I've just given some numbers here. And I think if you Google any of them, it's very easy to speak to somebody over the phone and to just kind of debrief and vent if you need to. It's also important, I think, for us to remember that if we are feeling unsafe in our homes at this point, that there is also help available, that you don't have to stay in a situation that's uncomfortable, that's scary, and children don't have to be exposed to that. So if you are in that situation, you really need to access some support and some help. And lastly, I've just got a slide here to show you an example of some of the resources that are available. WHO, the World Health Organization, and UNICEF have put out really nice one-page guidelines on parenting. There's a really great book on coronavirus and what it means and all about it. And there's activities to calm yourself down. And the South African Department of Health also has got some really basic guidelines and resources in various languages, all of which will be really helpful if you need. And that's it for me. Thank you.
Jazakallah khair, Sadiyya, for that interesting talk about the psychological aspects during the lockdown and because of COVID. Some interesting insights there. I think that concludes the formal part of our panel of our discussion. I think we can move over to now a more informal part of it, where we can address some questions to the panel. I think the first question would be to Sister Waheeda. Number one, are these guidelines only for lockdown, or are they relatable to elsewhere? I think the answer is self-evident, but just a bit of guidance. Should we adapt some of these guidelines? And where can we get more information about these guidelines? Is there a website, or is there somebody we can contact to get more the hard copies of these guidelines?
So the guidelines we put for our times at the moment during COVID, but if you look at them, they are fairly general, and they can be applied to all situations going forward with children. If parents would like an electronic copy of or a copy of our presentation, it will be, they can contact the IMA officers, and they can speak to our office, our regional manager, Kashifa Martin. She has electronic copies of all our talks that we've done so far.
And the next question we have is for Sister Aamina. It's got to do with our posture and screen time. Because of the screen time, are there any recommended or specific exercises we can do for parents and kids to strengthen those muscle groups that are affected because of our poor posture and increased screen time during this COVID period? Aamina?
Jazakallah, Zahir, for that question. So just a brief overview. For every exercise or for every movement of a joint, you have two main muscle groups which are responsible for that movement. That's the agonist and the antagonist muscle group. And it's important to see which of these groups the child or the parent is struggling with, which one is weaker than the other, which one is overcompensating, which one is not working efficiently or recruiting appropriately. In general, this is just in general, if you feel that your child or a family member has a problem, please seek professional advice. So in general, we've seen with kids, that's usually your preschoolers and those of them going up to the age of about 13 or so, their core muscles seem to be not activating appropriately, especially now during lockdown, where we all tend to sit longer and longer and we're not as active as before. So a lot of exercises that can be done are very simple ones, like the plank position for adults. If your kids are slightly older, you might be able to explain it to them. So that's where you go down onto your elbows on the floor or a hard surface. So you're down on your elbows and you're balancing up on the tips of your toes. Your body should be quite straight, so that if you put a glass of water on your back, it shouldn't fall over. And you hold that for a couple of seconds. There's a few others as well. The simplest ones for kids, which you can incorporate into their activities during the day, be it schoolwork or coloring or whatever, is 4 points. So that's basically the crawling position that babies get into, down on your knees and on your hands. And you can get them to do an activity in that way. So you can get them to color or stick something up on the wall in front of them or so on. Another one is the 2 point position. So that's just on their knees and they can walk around or play some game like that. And then for the adults, do the full body workout. So like the squats that everybody hates, us included as physios, shoulder rolls forwards, shoulder rolls backwards, a couple of neck stretches as well. So if you think of a neck stretch, think of it when we're sitting down in salah and we make salam to the left and salam to the right. Just hold that position for a couple of seconds, for about 15 to 20 seconds. You could also do neck stretches where you're looking up into the ceiling or looking down at your toes. And a lot of these exercises are just general exercises that should be safe for everybody at home. So get the family to do it. You can even put up a couple of those videos you get on YouTube or wherever it may be, a 7-minute video, 10-minute video. Get the family to do it together. Total body workout should be best. Jazakallah.
Jazakallah, Aamina, for that answer. Our next question is then for...
Can I just come in here?
Yes, you can.
Sorry, so I just wanted to ask Aamina, we usually recommend children doing activities to promote or improve their muscle tone. So that's, activities like hanging or doing a handstand. Will those activities also help kids generally with their posture or strengthen those specific muscles that we're talking about that they need for an extended amount of time?
Those things like the handstands and all of that would be quite good or quite effective rather for kids who are able to do that. So those kids that are able to do cartwheels or handstands and so on, that is recommended for them, and they can use those activities as part of a game where they don't see it as doing exercise so much, but rather as playing with their friends or playing with the neighbors or whoever they may be playing with. So yes, those exercises are good. One of the other ones that are also quite good, which is related or quite similar to a handstand, is like a wheelbarrow. When we were younger, you'd go down and usually your mom or your dad, it's usually the dad that had more patience while mama is busy, would hold your feet up and you'd walk almost with your hands. So that's quite good. It can be taught to kids as young as 1.5. My little one is 18 months and he's doing that at the moment. So they catch on quite quickly. And most of these activities, they tend to see what the parents are doing and they try and copy that. So anything that you may want to do for yourself, just get the kids to join in. So those activities do help for your low muscle tone and things like that. Yes.
Thanks for that, Aamina. Our next question, I have a question for Zaakir. Zaakir, in terms of screen filters and that type of thing, currently with the COVID and lockdown, there's lots of opportunistic entrepreneurs, shall we say. So are there specific screen protectors or coatings or specific glasses we need, or is there sort of just a generic one that we can purchase?
Okay, Assalamu alaikum. Can you hear me clearly? You can hear me. So first of all, talking about the glasses, there's many coatings that you can put on the glasses. There's the anti-glare, sometimes even like a darker tint. I don't know if you can notice my glasses, but it's slightly darker, meaning that any light indoors in on the screen, it doesn't affect the eyes that much. And from all our computer shops, normally they sell, it's like kind of like a filter that you put on your glasses. You can put it on the screen as well. I don't know price-wise and not there, but you know, there's always a generic wherever. If you really look for it, there always you'll find one, you know.
Okay, no, I was just worried because sometimes you get people that say you need this specific one or this specific wavelength. But the good news is I think the emphasis is then more on reducing the glare onto the screen. Is probably the greatest benefit. Am I right?
Yeah, like I said, with the brightness of a screen, even you can just put it more dim. I think that's the easiest one to do.
Okay, Zaakir, thank you so much, Zaakir. And then I think the next question is directed then at Faaiza. In terms of healthy snacking or rewarding kids, should we be using unhealthy snacks, as rewards for kids during the lockdown if they do their chores, or should we specifically stick to only healthy snacking? Can you say, listen, you can have one bite of chocolate or whatever it is if you clean up your room, and is that encouraged?
Thank you for that question. So children should not be rewarded with snacks or with food. They should be rather rewarded with, say, if you've cleaned your room for a whole week, we can play a game of Monopoly, or we can, go for a longer walk outside, or we can go out and ride bikes. You don't want to reward good behavior with food. Especially as children get older, it tends to set in, and that's where overeating and rewarding good behavior with food becomes a problem. So keeping the snacks mostly healthy snacks, fruit, unsalted nuts, whole grain snacks, and then keeping those unhealthy snacks for the weekends. So snacking should really be unhealthy snacks should be sometimes foods, where children are eating them sometimes every now and then, and having mostly healthy snacks most days of the week.
So what's your feeling about, Faaiza? So what's your feeling about sort of putting characters to food? So saying this is a good food and that's a bad food. And do you think it's a good thing, or should we just stick to healthy and unhealthy?
Essentially, all foods, whether healthy or unhealthy, can fit into a balanced, healthy diet. The problem is when people overindulge in the unhealthy stuff, that they take in too much, too many processed foods and too many salty foods and too many sugary foods. So people should be aware that there are healthy foods and there are unhealthy foods, and they have to be aware of how many of each I'm eating a day or a week, and how much of physical activity I'm doing to burn up those calories. Because a lot of people have been told, I've seen people joke about their lockdown tummies and things like that. So, you don't want to put on a lot of weight during this time, only to have to lose it later on.
Zaakir, thanks for that, Faaiza. Just our last few questions. There's a question for Sadiyya. You mentioned about the relate and reason. We've got a question on the group about returning to school. But before returning to school, what would be the most important aspects to discuss with the kids to cope with this big change? Because you get some kids that say, listen, we're going to school, but it's like a prison because we can't play with our friends, we're social distancing, we got to go maybe 2 or 3 times a day, we cannot socialize during break times, our temperatures are checked, our movements are monitored. So how should we prepare our kids psychologically for going back post-lockdown to school?
Zaakir, for the question, and I'm sorry, I meant to mention that, and I think this last 2 weeks have been particularly difficult for parents who've had to send their children to school, because the decision about whether you should or shouldn't was also difficult. And I know from my own daughter that going back has been a challenge. Like you say, there's so many more restrictions on their movement and their behavior that it's added a different layer of stress, I think. I think, as with everything else, you need to manage the expectations. You need to prepare them. And I think the fact that many of the schools have sent out videos explaining to children, this is what you're going to experience when you get to school, is good, because it allows them to already prepare for that. So it's not a surprise when they're there. And also to educate them and give them information as needed. So a lot of the times, kids feel like they can't control things, and we do, and same as for us. And part of that is understanding that we not everything is in our control, but taking care of our health and our family's health and our community's health is in our control. And these are just some of the measures that we need to follow at this point to get to the next phase. And also tell them that chances are it is temporary. Things will change in time. It may be slow and we don't have the answer, but it's also important to answer questions that children give you as honestly as possible. So give them age appropriate information. So for little children, you don't have to tell them how many deaths there are and all the rates, but you can tell them as much as they can understand and teach them the basic safety measures that we've all been taught now.
And Sadiyya, when should then, let's say we do these things and the kids still have problems coping, what are the danger signs? When should we seek professional help?
Like I said, if you are noticing in your children a change from the usual pattern of behavior, so some children are just more hyperactive than others, and that's their usual behavior. So that's nothing to worry about. But if you are noticing that for some reason, if you know your child and this is the way your child usually is, and all of a sudden they're more withdrawn, or they're talking less to people in the house, or they kind of acting out and becoming quite aggressive towards their siblings, and you're not able to calm them down yourself and regulate that, then I think it's important to just seek outside help. It doesn't have to be for long-term therapy, and it doesn't mean that there's something wrong with the child or they have a mental health problem. It's really that this is a stressful situation, and sometimes we just need to talk to someone to be able to get through it. So it's also important, I think, to normalize the feelings, because sometimes children think they're in it alone. So to explain to them that what they are feeling is normal in an abnormal situation, So, and for us as well to remember that all of these feelings of stress and panic and anxiety is a normal response to an abnormal situation. So there's nothing wrong with us. This is just our way of coping, and in time we'll develop coping skills to deal with this as well.
Jazakallah khair for that, Sadiyya. I must say, COVID is, I think, challenged a lot of us, but it's also brought out the best of a lot of us. I think, in conclusion, I'd like to thank everybody from the panel, all the therapists that have put a lot of hours into developing these guidelines, into collating them, into presenting them, into defending them on many of the social media groups where they were posted, and to also try and cut through all the dearth of information out there and concisely tell us simple guidelines, easy to follow guidelines, and to make yourselves accessible so that we can now interrogate these guidelines. So I just like to say Jazakallah to all of you that have taken your time out and given us all this information. I think we'll try and post as much of the information as links with this video so that people can get more information. And I just like to thank you all. Jazakumullah khair.